Hi there, everybody, and welcome to Hi There with Rabbi Leah. It is so good to see all of you, even though I can't really see you, and I'm just knowing that you're out there is wonderful. And I hope you all had a great weekend and a great Monday. And here we are, Tuesday again. And just a reminder that this program will show a couple times. So if you're watching now and you have any friends who you think might enjoy it and want to tune in and this afternoon, they're certainly welcome to do so. So today I'm going to finish up the three-part program that I've been doing on the history of Jews and plagues. And the first session, just as a quick reminder, I talked about the occurrence of plagues in biblical literature and how prolific plagues were. We read about at least 70 different plagues throughout the Bible, many of them in the Torah, and most of them coming down upon the Israelites as punishment for some sort of ill behavior perceived by Moses and God. And we read on a number of occasions where Moses actually falls on his face before God and bows down and prostrates himself and says, God, what am I going to do with these people? They are really impossible. And God punishes them. There's usually a plague which wipes a number of them out. And then things are better again, and until the next time there's a plague for some sort of perceived ill behavior. The second session of the three, I spoke to you about the history of persecutions and, really how the Jews were persecuted, particularly during the Black Plague, which spread across Europe and was there for several hundred years. And not knowing the cause of the plague, clearly people were looking for some sort of a scapegoat. And Jews, because of their different dietary considerations, the way in which they washed their hands constantly before a meal and said a blessing with the hand washing, because they stayed in their own insular communities where they often did not go out into the general communities and intermingle with other people. They were seen as carriers, purveyors, and possibly the cause of the plague. And so there were many, what we would nowadays call a pogrom, but at that time that word didn't exist because most of this took place in Northern Europe. And it was so bad, even though officially at the time there were church policies that tried to protect the Jews because Jesus had been Jewish. We're talking about in the Middle Ages, and yet we see many massacres of Jews, the complete obliteration of the Belgian Jewish community, what the Gentiles perceived as this strange immunity that Jews had to the disease, which was not the case because Jews were still getting sick and dying, and yet the Gentiles were convinced that something bad was going on, that the Jews were perpetrating this plague upon the other people, and possibly that it had something to do with the fact that Jews were not using the main water supplies in these various cities and were using their own water supply in their own community, and therefore were not getting sick. And so as much as some of the officials in these communities tried to disengage the general population from having these concerns that it was because of the Jews, unfortunately, that was not successful. And anti-Semitism was rampant and was so bad with these massacres that were, by the way, one of which happened on Valentine's Day, which I don't think was St. Valentine's Day at the time. I don't know when St. Valentine's Day came into being, but in the 14th century, finally Jews began to leave. And then, of course, in the 15th century, there was a general expulsion of Jews from most of the northern and western European areas to the Eastern European countries of Lithuania and Czechoslovakia, which was not called Czechoslovakia at the time, but into what we now know of as the Pale of Settlement, which is where the Jews were now going to remain for many, many, many years. In fact, about 500 years. That's a long time. So what I wanted to look at next was to see if there are any modern Jewish writers who are writing about the treatment of Jews during the bubonic plague, the Black Plague, and the treatment of Jews during other times of history in terms of scapegoating them for various ills that were within their societies. In particular, though, I was interested in looking to see if anything had been written about how the Black Plague of the Middle Ages compared to the COVID virus, which we are encountering now. And lo and behold, there is a publication known as the Jewish Quarterly Review, which has writings by various Jewish scholars, theologians, historians, and I found it very interesting that the first name that cropped up was Susan L. Einbinder. And Susan Einbinder was my professor of Jewish literature, Hebrew literature, at HUC in Cincinnati during my first year on that campus, my second year of rabbinical school. And she is now professor of Hebrew and Judaic studies and comparative literature at the University of Connecticut in Storrs. But I will never forget a very fateful day, September 11th of 2001, when my class was all settled into the classroom on the campus of Hebrew Union College, and Dr. Einbinder came into the room a little bit late and looked ashen. She looked as if she had just heard some really horrible news. And of course, we have a Hebrew Union College campus in New York, and one in LA, one in Cincinnati, and the one in Israel. And she relayed to us that just minutes before our class, a plane had flown into the World Trade Center. And it wasn't much longer after that than we got the word that a second plane had hit. And then the dean of the campus came in and sent all the students home, because evidently the FBI had been in contact with the administration of the college and said, you need to get your students out there now. We don't know what's happening. We don't know who has done this. Interesting that there are conspiracy theorists who would tell you that it was not, that either it didn't happen, that the whole thing was a hoax, or that the Jews were responsible for the bombing of the World Trade Centers. So I want to talk to you about what Susan Einbinder said, and then three other scholars, all of whom look at the coronavirus and the Black Plague, comparing them in terms of through a different lens. So we're going to start with Dr. Einbinder. I just want to preface this by saying that over the weekend, while I was watching the news, I saw a report that showed two men, elderly men, videos of two elderly men in separate incidents being attacked. This happened in the San Francisco Bay Area. The first one was punched and kicked and thrown to the ground and ended up with serious injuries. And the second one was thrown to the ground so hard that he hit his head and later died. What did these two elderly men have in common? They were both of Chinese descent. And this was, both of these were considered to be hate crimes brought on by negative talk about Asian populations as a result of what had been called the Wuhan flu. And I don't think I need to say who perpetrated and then perpetuated calling it the Wuhan flu, the China flu, the Kung flu, and so on. And evidently, the ADL, which not only, the Anti-Defamation League, which not only looks at anti-Jewish incidents, but also other forms of hate crimes, has said that since the pandemic has struck, there has been a significant increase in crimes against Asian Americans by those who believe that they're the ones responsible for bringing the coronavirus to the United States and to other countries throughout the world. What Susan Einbinder says is that the bubonic plague launched a second plague pandemic, and that had continuing outbreaks for the next 500 years. That is a very long time, and God willing, coronavirus will not be with us for 500 years. And by the 15th century, medical experts, such as they were at the time, saw that the plague was increasingly indiscriminate. So it wasn't just a certain class of people or a certain nationality of people or a certain immigrant of people that were coming down with the plague, but they couldn't understand why it was so indiscriminate. And then, like now, whether it's the bubonic plague or the coronavirus, Dr. Einbinder says, it tested the limits of what people understood about the disease, what caused it, what might have stopped it, and so on. And particularly in the 15th century, we're talking about a medical community that is, still cutting and using leeches and all kinds of strange processes to fight disease. And most of all, it was still believed that if you got sick, it was because of something you had done, not because of a viral infection or a bacterial infection. And in fact, the bubonic plague was not spread human to human. The bubonic plague was the result of a fly, an infected fly that bit. And so there were confined populations like ghettos, and today we also see confined populations. And in fact, the first cases of the coronavirus happened on cruise ships. those were the first cases, and there was a tremendous amount of controversy as to whether or not a cruise ship should be allowed to come back into port in the United States, because we really didn't know at the time what was going on with this. And even though these people were going to go directly to a hospital and be quarantined and so on, it was such a mystery. And so we see violence at this time, and actually as early as the early 1300s, the early 14th century, that focused on not only anti-Jewish violence, but also tended to attack and target more marginal populations. So the poor, foreigners, sometimes even physicians, because the physicians didn't know how to cure this, and each outbreak that came had kind of its own context and its own dynamic. And we can make some comparisons, but I think we have to be careful, because we don't want to blame certain individuals. And yet, on the other hand, we do know that there are populations in the United States, and most likely throughout the world, who are more significantly impacted by the coronavirus. Certainly communities of color, elderly people, those who have pre-existing conditions, and so on. But we have seen the injustices of our medical community, which we've known about for generations, in terms of the impact that this has had on poor communities and communities of color who don't have access to medical care, have legitimate concerns, questions, and fears of the medical community based upon historical events that came before, and so on. So these injustices are really coming to the surface, I hope, in a much more pronounced way than prior to the pandemic. Dr. Einbinder says that she thinks that the question for historians is how we compare past and present events. In some general ways, comparing coronavirus and the plague is helpful. Many non-biological similarities are striking, and she talks about things like prayers, miracle cures, and prophylactics. I mean, how often did we hear about chloroquine and shining light into the body and using disinfectants in the body, and other miracle cures and prophylactics, and other things like the isolation methods of making sure that people go into quarantine, and all the resource disparities that we see, and strain on families and institutions and the economy. And all of those exist now as they did during the time of the plague, which lasted for 500 years. You saw many of the same things. Plague is also a result of environmental disruptions and disruptions among species. And although they don't absolutely know the root cause of coronavirus, they believe that it started in a wet market in China with the sale of some sort of an animal which was probably infected. So, carriers emerge. We know about bats that carry disease and rats that carry disease and so on. But the plague, one of the distinctions that Dr. Einbinder makes is that the plague is transmitted by flea, and it can now be treated by antibiotics. In contrast, COVID-19 is extremely contagious, and it's, we're still learning more and more about the incubation, and we're learning more and more about immunity. They have found that people who were had COVID towards the beginning of the outbreak and had the antibodies may still have the antibodies, but evidently some of them have contracted coronavirus again because the antibodies that they have were not the right antibodies for some of the new variants that we're seeing. So even though the biological differences between bubonic plague and the coronavirus are extreme in terms of transmission, where they come from, how they're treated, and so on, that those differences aren't always reflected in the societal realm. And people react similarly by isolating, by looking for miracle cures, by prayer, by having debates. I mean, look at the debates that we saw on almost a daily basis between Anthony Fauci and Dr. Susan Birx, and then some of the other experts that were brought in by the administration to dismiss what they were saying, and nobody knew exactly what to believe. So the aftermath of these sorts of debates is clear. And in 1631, when the plague ended in Padua, Italy, 60% of the ghetto, the Jewish ghetto, was dead by that time. And wearily, the physician Abraham Catalano wrote that life resumed in an upside-down world, a world we haven't reached yet for comparison. So I don't know exactly what is meant about an upside-down world in the early 17th century in Padua, Italy. But after 500 years of plague assaulting this part of Europe, it goes without saying that behaviors changed. And although we can see very clearly now some of our behaviors changing in terms of social distancing, in terms of pressure for people to get the vaccine, in terms of wearing masks, and somebody who's got their mask down here and not over their nose is liable to get a chastising from somebody who sees them. Guilty as charged. Sorry, everybody. So we don't really know what that upside down world is going to look like for us. We may be wearing masks for the next 50 years, and it'll just become part of our everyday attire. We don't know. We'll have to look back on it 50 years from now and see where we are. Okay. The next more modern view of this is a gentleman by the name of Joshua Teplitsky, who's an assistant professor of history at Stony Brook University. And he has been writing a book for the last 2 years about Jews and plague, long before the pandemic started. So for him, this has been a surreal experience because he's been collecting all kinds of materials, looking at an outbreak of the plague in Prague in the year 1713. So how specific is that, right? And he's trying to reconstruct what happened there, and then take a look at some of the communal and the cultural aspects of that final occurrence of the disease in Prague as it impacted the life of the Jewish community up until early modernity. So the plague in Prague claimed anywhere between a quarter and a third of the city's inhabitants. And it inspired new public health measures, collective action among Jews, rabbinic responsa, and even Yiddish memorialization. So there is Yiddish literature that talks about the plague. And the professor says he felt like his study was ripped from the headlines because it was a story with fresh urgency and new meaning. And he was once looking at this project as something kind of anachronistic, and then he started to look at questions of public health responses to a contagion alongside of social encounters. And he became really attuned to something specifically. And the specific thing that he became attuned to was the emotional foreboding that precedes the crest of an epidemic. So if you think back to March, you will know exactly what he is talking about. When we knew that there was going to be a shutdown, for lack of a better expression, all hell broke loose. Think about the shelves in the grocery stores. Now, I've lived in cities where there are terrible bouts of inclement weather. I mean, I lived in the Midwest for much of my life, and we knew when there was a huge storm coming, and we knew when we had to go out and get groceries. I lived in Florida for 7 years and got used to the hurricane warnings and had water and had supplies and had batteries and so on. We also know, God forbid, in California, if there is a wildfire that's going to take place. So there are ways in which for us to prepare. But with a plague, there isn't a playbook because we really don't know how long it's going to last. And people went hysterical. You couldn't buy toilet paper. You couldn't buy paper towels. You could not buy cleansers or disinfectants or Purell or any of the things that we needed. We were wiping down our groceries. We were not leaving our homes. I mean, this is something that I don't think any of us, regardless of our age, have experienced in our lifetime. And so it was, by all accounts, a time of frenzy and fear. And he says that this state of dread or sense of impending or waiting for the worst to come was also evident from his studies of the Black Plague. And he says that when he reads about those times in his research and compares them to what happened here in the United States and throughout the world, he sees such incredible similarities, and he relies on a writer, a gentleman by the name of Anshel Weiner of Prague, who on Monday, August 7th, 1713, which was 2 weeks after the first reports of the illness, he left his home elsewhere out of fear of the pestilence, and he intended to continue his journey onward now that the plague had come into Prague as well, because he was currently in Prague. And in the middle of his flight from Prague, with the future so uncertain, he evidently had some standing in the Jewish court in Prague and played into those to make some provisions for his family. And he cited Kohelet, Ecclesiastes, and said, "For man cannot know his time." In other words, I don't know if this thing is going to get me or not, but if it does, I'm arranging for the transfer of all my property to my wife, Mirel. So we see this sense of fear and flight and resignation. And, I just wonder how many people updated their wills, bought life insurance, and went through other major changes in order to accommodate for this very, this enormous question mark, this huge unknown of how this plague was going to impact us. So Anshel was fearing that same dread and that same anxiety, and that pandemic was even quicker, and there were panicked responses, and that advanced dread was coming. And so what this writer says, what Professor Teplitsky says, is that this story reveals the weight of waiting for the next shoe to drop, and the power of emotions in these worldwide historical events. And today, when we are on a 24-hour news cycle, and those numbers come up on the screen showing new infections, new deaths, total infections, total deaths for the United States, and then the worldwide numbers, it gives us a sense of the enormity of what it is we are going through. And in fact, I feel that we are not numb to it, but that we protect ourselves to a certain degree by hearing the numbers possibly and not understanding fully the impact of what the numbers mean. And it may only be at some point in the future that the full impact of this pandemic on our world and on our country and in our own communities and in our own families, for those who have lost loved ones or have loved ones who've become very ill from the pandemic, it may take some distance before we're truly able to understand. And like Anshel Weiner, we may be making legal preparations. We may be thinking of our loved ones and imagining what we can do to improve their lives and to maintain some sort of normalcy, even in the face of something that is so uncertain. Think about children not going to school for almost an entire year now. Think about people working in their homes, making YouTube videos for their congregations to see. I'm not the only rabbi doing this. There are no rabbis in the San Diego community who have yet gone back to live services. And we are coming up on almost a year now. And so I don't think, without having the privilege of time, that we are not going to fully understand the impact until we look back sometime in the future to see what this has done to us. So I only covered 2 of the scholars today, and I'd like to cover the other 2. I apologize, I was a little bit long-winded, but I think this is important, and I think this is so interesting to see these comparisons. And on next week's program, I will finish up talking about the wandering Jew as a carrier of the disease, and then lessons from the recent past with 2 other scholars. So I hope you enjoyed this. I went a few minutes over, but I'm hoping that this was interesting to you. And again, I want to thank you for joining me for Hi There. And I will see you, I'll see assisted living and independent living for programs on Wednesday. Thursday is a very important and a very exciting day with our second COVID vaccines. And then again, blessings on Friday night. Shabbat service is Saturday morning, so we got a very full and busy week. Not to mention, Purim is coming in a little over a week. So, lehitraot, everybody. Bye-bye from Hi There with Rabbi Leah. Have a wonderful day. Bye-bye.